Hello, everyone. So, your favorite show on Wednesday afternoon, Reflect and Reset with Maria and
Gina.
Hi. We have our usual
We're back in our
setup.
space.
We're very, very happy that we're doing this setup, and you might ask, why are we not socially distancing? So, Dr. Gonzalez is a doctor that works with our in our facility, and we actually all get tested every week, and we work together. This is how we are. We're always talking and meeting, and so we decided to actually go back to the way that we
Yeah.
used to do our shows, and it feels awesome.
Yeah, it does. It feels, it's so much easier. We don't lose connection,
Right.
right? I'm not going to lose connection with you. So, and the good thing is, without further ado, we already just introduced you, right? So, Dr. Gonzalez, I'm sorry, I'm slurring my words today. He works with us. She's an interventional cardiologist here at Formé. And actually, we were talking about this before the show. People don't really know what interventional cardiology is versus cardiology, right? Because I actually had to look it up, and I should know because being in the medical field. But so maybe you can shed some light on that.
Right. So thank you, Gina and Maria, for having me here again. It feels like it was like 3 years ago, but it was almost
A couple months
not
ago.
even 2 months ago,
Yeah.
right, when I was
This
here.
is-
So yes, it's always a pleasure.
Thank you.
So what's the difference between an interventional cardiologist and a general cardiologist? Interventional cardiologists actually do procedures. They are considered invasive. We do coronary angiograms. We do put stents. We treat acute myocardial infarctions. And people who are coming with a heart attack, we treat them. We open up the blockages. We also take care of the carotids, the blockages in the legs, in the arteries of the kidneys. So another subdivision of interventional cardiologists is people who deal with the valves. They put valves when there is a tightness in the valves in the heart. So it's a whole
So you actually do surgeries?
umbrella.
You do?
It's not surgery; it's minimally invasive.
I see.
So we do it either through the leg or through the arm.
Mhm.
So 95% of my coronary cases I do it through the arm. It's just easier for the patients. They can walk, they can eat, they can just go home the same day. There is less bleeding risk, less infection. It's just more comfortable. But when we can't, for some reason, we can't complete the procedure to the arm, then we go through the leg. And it's through a big IV. It's like a sheath that we put, and then through there we deal with the catheters.
So you've been working with us now for, well, actually it was pre-COVID,
Yeah.
Mm-hmm.
and then we took a little break and we came back together, and now we are really working hard, and the practice is growing. You're seeing a lot more patients, and we've been able to create a cardiac lab in a way. I mean, we're not doing those procedures that you were talking about, but let's talk a little bit about the procedures that we're doing in our facility now.
Right. So, we have a big population. We treat a big population here, and we have a lot of diabetes, hypertension, high cholesterol, obesity. So there is a big prevalence of that in this community. One of the important things treating this population is to screen them for heart disease, for blockages, for arrhythmias. So right now we are offering a battery of tests to screen people and test if they're having any symptoms and catch them early. That's the whole point, right? Catch them early if there's any problems growing, brewing. So we're able to diagnose it and treat it to prevent further complications, and getting them to the lab, which is what the whole point of prevention, right? So we're offering echocardiograms, which is an ultrasound of the heart. With that, we look at the structural part of the heart, the function, if it's strong, if it's weak, any valvular problems. we're also doing stress echoes, which is an echo coupled with the stress testing. We put the patient on a treadmill, and then we compare the ultrasound images after at peak exercise with the recent images. And basically, we're trying to see if there is any abnormalities, any suggestion of ischemia, or a certain part of the heart is not getting enough oxygen. We do holters, Holter monitors, event monitoring for patients who have palpitations and they might be having an arrhythmia, patients that are feeling lightheaded. There is many indications for that. Patients, we hook them here in the office to the monitor. They go home and they wear the monitor for certain amount of time, and then we get the read and we plan accordingly. We also do vascular ultrasounds. We screen for the carotids, for the abdominal aorta, for aneurysms. It's important for patients who are hypertensive, men over age of 50, those smokers. They tend to form like weakening in the walls of the aorta, and that weakened area may grow. That's called an aneurysm. It can rupture, and patient died. So we are screening for that, and that's a recommendation. In hopes to catch those people who already have an aneurysm and follow them.
Yeah, and
because they might need surgery.
And what we find is that what people don't understand is that there are different diagnoses that people have that need to see a cardiologist. Like, for example, a diabetic would think that they need to see the podiatrist and their internal medicine doctor, but they really need to see a cardiologist. Now, what does diabetes have to do with cardiology? How does diabetes affect the heart?
So diabetes, type 1, type 2, it's very prevalent. Most of the patients who have diabetes end up having heart disease. Just because diabetes, just like high blood pressure, smoking, cholesterol, obesity, over time, it damages the linings of the arteries. It damages the nerves that supply the heart. And people develop heart blocks, arrhythmias, blockages in the arteries of the heart that may weaken and develop cardiac insufficiency. So it's very important to catch and treat these people aggressively before they develop that.
And as far as usually people that have chronic conditions like diabetics, many of them also end up having hypertension, right?
Mm-hmm. Right.
And why is that? Like you would ask, like why is it that goes like hand in hand?
Well, it's many things, right? Many things. Diabetes damage the lining of the arteries of the heart, right? And it will start creating thickening or hardening of the vessels that causes hypertension. Some people have genetic predisposition, obesity. It's an inflammatory state that also raises the blood pressure. So there are many factors. Diet. Also.
And I think some people don't understand the high risk when you have hypertension. This is something that we were doing, we're still doing. Every time somebody comes in to get a COVID test, we check. And what we found during the COVID time, we're still in the pandemic,
Right.
but when we were at 40% positive people, that so many people had hypertension. And one of the concerns, I remember this man specifically, that his blood pressure was like 210 over 155.
Wow.
He had not taken his medicine for 1 week. And we were trying to get him to go to the emergency room from here because we were concerned. So can you explain, like, why is it important to manage your high blood pressure?
What happens with chronic high blood pressure that is getting untreated or is getting not controlled? What happens is that the heart is a pump that has to squeeze the blood out against all those high pressures. So it's like you're running a marathon and you're not allowed to stop. That's the way I explain it to the patients. At some point, you're going to collapse. And that's the same thing that happens to the heart. The heart weakens. First, it hypertrophied, it gets thickened, it doesn't relax well, but then over time, it grows, it dilates, and then there when it comes the heart failure with reduced EF, which is like a weakened heart, a weak heart. Also, high blood pressure creates predisposes to blockages in the heart, which in turn doesn't allow oxygen and the nutrients to supply the muscle, so the heart is also kind of weakened. Hypertension causes strokes. That person, that's what we call it. If he wasn't having any symptoms, that's a hypertensive urgency.
Yeah.
So he could have a brain bleed at any point.
We try to explain that, and I think there's a challenge with men more than women, because I remember, we were telling him, you have to go. You have to go to the emergency room. We were concerned because he rushed out of here to go to work. And he's like, no, I have to go to work. I cannot go. And we're like, but you are at risk of having a stroke.
That's why hypertension is called the silent killer, because people don't have symptoms until they do, and until it's too late, until the heart attack comes or the stroke comes or they develop kidney failure, because there is so much pressure the kidneys can take, and then they don't, they start retaining water, and it's, they get flooded, their lungs get pulmonary edema, and it's already in the advanced stages
Without
with multiple
checking
organs.
with the machine, the blood pressure machine, how would somebody know? Like if the guy didn't come here
Yeah.
and didn't have it checked, what symptoms would he feel that would kind of show that he?
That's why he calls a silent killer. This guy
You don't
was
know.
probably not having any symptoms.
No, he said, I feel fine.
Right.
You don't know.
Right. Some people get headaches.
Yeah.
Right. Some people get lightheaded. Some
Mhm.
people say, I asked them, why did you check your blood pressure? Oh, I wasn't feeling right. I was feeling lightheaded, or I was having a headache. But most people don't have any symptoms until the
It's too
stroke
late.
comes. Yeah, exactly.
Yeah.
So seeing a cardiologist is important once you have been diagnosed with high blood pressure, especially for patients that have hypertension difficult to control. If you are in 3 meds and your blood pressure is still not well controlled, then you might consider, and we're getting a lot of referrals from primary physicians that are sending us this type of patients to do a further workup into why is this patient so uncontrolled? Are we missing something else? Because sometimes we do find, it's only 20% of the cases, but we do find things that we can reverse
Mhm.
and we can treat, and the blood pressure goes down.
And what about cholesterol too? Cholesterol is another killer.
Exactly. Diabetes is linked to a hypercholesterolemia, hypertension too. It's a whole metabolic syndrome.
But cholesterol is when you have the particles, right, going through your blood that hardens. Is that
Right?
And then
The plaques start forming when there is damage in the endothelial layer of the arteries, and then cholesterol plaques starts build up. Sometimes those cholesterol plaques is hardened, and they get kind of like covered with calcium, but sometimes they become unstable, they rupture, and that's when patients have a heart attack.
got it? Wow, scary.
So you would recommend that every patient that is diagnosed as a diabetic, that they should see a cardiologist?
If they're having symptoms, if they've been a diabetic for a long time, it would be reasonable just to make sure that there is nothing
And this is for type 2
missing.
or both?
Both.
And what about for a
Especially
young
the
child?
type 1 diabetes.
Yeah, what
The
about a
type 1
young
diabetes that have been, diabetics for a long time. Those patients are, by the time I see them as an adult, they've been dealing with hyperglycemia for 10 years.
Yeah, my niece was 3 when she was diagnosed with type 1.
Right.
She's 23 now.
Right.
So should she be followed by a cardiologist now at that
Not
age?
not followed. If she doesn't have any symptoms, if she's controlled, I think it would be okay. Maybe a one-time visit just to make
Mhm.
sure everything is fine. An
Kind of give you a
EKG,
baseline, right? A little
a
baseline.
baseline.
Mhm.
Yeah, it would be reasonable.
Talking about reasonable, so there are preventive medicine that we do, right? We do a yearly physical, we do a colonoscopy at the age of 50. What is the type of cardiology procedure, preventive medicine that people should be doing at what age?
Okay, so we would check, and this is not particular to cardiologists. Any primary care should do this, right? We should check the lipids once every 3 to 5 years. Um, yeah, so the cholesterol, hemoglobin A1C to screen for diabetes, thyroid function to screen for thyroid disorders. Um,
There
Does
is
that
not
link?
like,
Does that
those-
link to cardiology?
yes,
Because
yes.
I have thyroid disease.
Right. So for uncontrolled thyroid, like hyperthyroidism or hypothyroidism, um, we see heart failure.
Really? I
Yes.
didn't know that.
Yes.
Wow.
For like I mentioned a little bit earlier, age over 50, smokers, patients with hypertension, patients with CKD, with renal disease. Recommendations are to screen for abdominal aortic aneurysms, check the blood pressure. I like to check blood pressures in both arms, legs. When we're examining the patient, we are listening for any fluids to see if there is any plaques in the arteries that go up to the brain. Those.
and I know COVID has taken many people that have heart
And an
condition.
EKG. Sorry, that's
An
like
EKG.
the bread and butter, the EKG. Yes.
But going back, and we'll go to the COVID,
Yeah.
how often should you have an EKG?
Well, it depends, right? If you have no if you have no complaints, and your EKG is normal, so you don't need a routine serial EKGs.
Should you have one at every physical? Once a year,
No,
depending on the age, or
depending on your medical problems, depending if you have any issue, but it's not the routine recommendation. Every year you should have an EKG.
the primary doctor, I guess, will decide if this is something that if it's your needs.
Right.
This is very interesting. Going back to COVID, so I actually was talking to someone the other day this week that was telling me that his friend, 60 years old, very healthy guy, they both got COVID. They were working on a project, and the guy that had the heart condition, I don't know what it was, but he said he passed away.
Mhm.
So did you see a lot of cases where this is happening or happened?
Absolutely. And this is something that we do know now with our experience here in New York and across the world. Patients with chronic conditions like diabetes, especially if it's uncontrolled, right? Diabetes, hypertension, heart disease, heart failure, cabbage, patients who have heart bypass, kidney problems, and obesity. I saw, they do worse. Their mortality risk is higher than those with no chronic conditions. Most of the young people, and this is my personal experience, young people without any chronic conditions that I saw that ended up in the ICU and they die were obese.
Hmm.
So obesity is a big risk factor for problems if you get COVID.
And you know what I learned with my father who passed away? If you don't take care of your heart, and once your heart dies, you can't get that part back. And you only use, at one point, my father was only using 20%. He was at 20% of what the capacity of his heart should have been. And there was no way of, the rest of the heart was dead. There was no way of getting it back.
Right. We do have heart transplants.
Yeah.
But it's very difficult.
Mhm.
And then you also, to get a transplant is with a certain physical condition, which if you've been dealing with heart failure for a long time, probably your kidneys are not
Right.
good, your liver is not good. There is another battery of problems that may not make you candidate for a heart transplant.
Yeah.
So what I tell 80% of my visits, it's patient education.
Right.
It's not about dying. It's not about having a heart attack. It's about living with the consequences of a heart attack or with the consequences of a stroke.
Right.
Yeah.
It's not, it's not pleasant when you cannot walk half a block without having to stop to catch your breath.
Yeah.
So it's
You don't think about that. You don't think
No.
because you're healthy.
Until
you
it
don't think
happens.
about that until it happens.
Until it
Then
happens.
you're like, damn, I wish I did this. Damn, I wish I listened to Dr. Gonzalez, guys.
Dr. Gonzalez, if you are a young person and you are very overweight, should that person be worried about cardiac conditions?
Absolutely.
And is that a candidate to come and actually have a consultation? Will you say that if you are obese and you haven't seen, you're young, so you feel, well, I'm young, I don't have to worry about my heart because I'm young, but I am obese. Is that somebody that should be coming to do at least one consultation with a cardiologist?
I think it would be reasonable if they are in the mindset of changing their lifestyles, right? And sometimes just talking with the physician or with other people, sometimes they just, something clicks that, oh, I had not thought about that, so
Maybe it's the fear. Sometimes you have to instill a little fear that this is going in a bad direction. And you could say it, I could say it when it comes from the doctor.
That's right. When they come in and their blood pressure is high, plus they know they are not doing well. They know they are, obese, and they know they're not as mobile as they would like. Plus now they're having high blood pressure, or when we check their bloods, cholesterol is through the roof, or they're having pre-diabetes. Sometimes that kind of it's enough to trigger that response that will make them start walking. And the way I tell my obese patients, you don't have to, go to the gym or run a marathon. Just start walking.
Right.
Just start moving. Get your heart pumping. But start.
A few minutes a day.
Few minutes a day.
And then you build up.
Exactly.
We tried to do that with my dad. It didn't work. He got on the treadmill for 3 minutes and he's like, okay, I'm done. And he never got back on.
Well, but it's hard when your heart is,
Yeah, he was
20%.
older too when we really started to work.
And we're talking about something that affects so many people.
Oh my God, so many people.
Why? I was talking to my daughter about that yesterday, and we were like, nobody wants to be obese. Why is this so hard? Like, what's your opinion? This is more of a philosophical question.
Our diet, it's not the same as it was 50 years ago. It's a lot of,
Fast foods.
Chemicals,
in the-
exactly, like things to ripen the fruit faster and to grow the chicken faster, all those preservatives, and they're not natural,
Hormones.
and not everybody can afford organic foods, right? Because they are expensive. Also, just our world is steered up to be sedentary. Right now, we have a bunch of electronics. We're always with the phone here, or the tablet, or the
TV,
iPad,
Netflix.
Our portions are like this when it comes out in a plate. I've been to Italy many times, and they're lean. People are lean there. The portions are smaller. They eat, a few meals, but they're small meals.
Small.
And they're not a big plate of pasta and then a big plate of chicken and a big plate of dessert and a big. They do everything.
And they
in
walk a
small
lot
parts.
too.
And they walk a lot, right?
That's
Right.
And I think their food might be also a little bit more organic.
Yes.
I think that's the issue. That's why I became a pescatarian, because I watched what's that documentary?
Game changer.
Game Changer. It changed. It definitely changed.
I didn't watch it, so I still eat meat. She's telling me if you watch it, you won't eat meat. I was
And
like, but
it's-
I really like meat. I don't want to
Yeah.
watch.
Well, when we start, when I started cardiology, there is an attending at Montefiore, Dr. Robert Osfeld. Hi, if you're watching. He has us watch during orientation a video called "Forks Over Knives."
Forks over knives.
Forks Over Knives, and he was able to put it in the TV channel at the all Montefiore places,
Mhm.
and it's really like if you watch that documentary, it's you're not gonna wanna eat meat again.
And do you
it's
eat meat?
true. I'm a pescatarian.
You are a
Yes,
pescatarian.
which is a huge step for Latino people.
Latino
Does your
people.
children eat meat?
No, she's vegetarian.
My daughter is also a vegetarian, and she's a pescatarian.
Yeah, she'll eat
so
meat. She'll eat fish.
she'll eat fish.
Yeah.
I also felt that it was a drastic change. I might get to some point where I would do a vegetarian diet. What I found is that there's so many, like we have those burgers from Fridays.
Uh-huh.
They're just like
Yeah, they're
burger.
what they're called, the
Impossible.
burger.
The Impossible.
The Beyond Burger.
Beyond Burger.
yeah.
Yeah. And it's delicious.
It's delicious.
I feel like I'm eating meat. And I definitely don't miss the meat as much, but there are certain things like I love oxtail. Oh, he's showing that our producer, who is wonderful, is showing.
Nuh-uh.
Oh,
Yeah,
there
I
it
didn't
is.
watch it. I didn't watch it.
Yep.
That's awesome. I
It's a great
think,
documentary.
I mean, one thing I'm going to encourage if you are somebody that is sort of in the fence, what do I do? Like, watch the documentaries. I think it gives you an insight. For me, the knowledge that I got from this documentary, I said, it's not worth it. Like, it's just for that few minutes of enjoying, and it's a personal choice. Obviously, we're not criticizing.
Right.
Gina has her choice. Everybody has a choice. It's a personal choice. I just felt that the risk outweighed the taste. Like that few minutes of this tastes delicious, it outweighs the outcome of the longevity that I want to create in my life. And that was basically it. And I made a decision after that documentary, no more.
That's great. But like you said, not everybody is.
It's a choice.
It's really a
Yeah.
personal choice, right? And what I tell my patients, because I'm trying to create a partnership between me and the patient. Otherwise, it's not gonna work, right? I can tell them whatever, but if they don't do it, what's the point? So what I tell them is like, you don't have to stop eating pork or beef or whatever it is that you like. Just don't have it every day. Every day of the week, just choose one day that's gonna be your cheat day, and then you do whatever you want.
Yep.
That one day, but most of the week, just change. Right?
Better.
I love what you're saying. It is about creating that relationship, and we can't judge. This is
Absolutely.
you start judging, then we start getting into negative connection, right? And that's not what you want from your patient. So
Absolutely not.
I love that, and that's why you are who you are, and that's why you're
With
growing,
us.
with us, and we're very, very lucky to have you. And I know we're getting towards the end of the show. We want to thank you. We want to thank you for the work that you're doing with us. You're definitely all in our mission, and we feel totally blessed. We always say, there's a door that opens and somebody comes in here and they're together with us in this mission to really impact our community. So Gina and I want to thank you from our hearts.
I'm the honored one. I mean, it's been incredible, and I'm looking forward to continue growing.
Oh,
Yes.
we love you.
So you guys are very lucky that we have Dr. Gonzalez with us.
Yes. So call and make your appointment.
Yes.
Everybody. At least get your baseline. Even people who don't think there's a problem, get your baseline. Trust me.
And before we leave, we want to thank our producer, Henry.
Henry.
Ramos.
Show your face, Henry.
Hi,
Henry.
Where are you?
Where are you?
There he is. Yay, Henry. In our studio in the back.
This is a whole production. So we want to thank Henry for all of your support. Henry, you'll put in the feed, you'll put the information on your company if anybody's interested in getting Henry to do their shows or any social media production.
Yeah.
Okay. We want to thank you for watching us, for supporting us. We want to thank our community. You guys have been amazing supporting Formé. We have been awarded Westchester Healthcare
Yeah, healthcare
Heroes. And we want to thank Westchester Magazine for acknowledging the work that we're doing. It's heartwarming for us to be recognized for what we love to do, which is taking care of you. Because at Formé,
our mission is your health.
Yes.
That's
That is
awesome.
us in Westchester Magazine. I love it. I love it. Thank you so much for your support. Remember to like the show. We'll see you
See you next
soon. Bye-bye.
Bye.